A 28-year-old woman walked into the emergency room late at night. She looked tired but calm. Her main complaint was simple: dizziness. She said she had been feeling lightheaded for the past 2 days, especially when standing up. She also mentioned fatigue, but nothing severe. Her blood pressure was slightly low, pulse was normal, and oxygen levels were fine. To most doctors, this looked like dehydration or stress. She even said, "I think I'm just overworked." And that sentence changed everything. The doctor advised fluids, rest, and reassurance. No scans, no advanced tests. She was discharged within an hour. To anyone watching, this seemed like the right decision. Thousands of patients come to the ER every day with dizziness. Most of them are fine, but medicine is not about what is common. It is about what is dangerous. 6 hours later, the dizziness returned, stronger. This time, it came with a strange pressure in her chest. Not pain, just tightness. She ignored it again. She told herself it was anxiety. Her breathing felt slightly uncomfortable, but she could still talk, still walk. That was the second warning sign. By morning, she was sweating excessively. Her heart felt like it was skipping beats. She tried to stand and almost collapsed. Her roommate noticed her pale face and rushed her back to the hospital. This time, the ER was busier. She explained her symptoms again: dizziness, fatigue, chest tightness, shortness of breath. The triage nurse noted mild tachycardia, but nothing alarming. Anxiety was mentioned again. She was asked to wait. Every minute mattered. While sitting in the waiting area, her vision blurred. Her hands started trembling. She felt an overwhelming sense of doom, something patients often describe before a major cardiac event. She collapsed to the floor. Doctors rushed her in. An ECG was done immediately. And this time, everything changed. The monitor showed an abnormal rhythm, dangerous and unstable. She was experiencing a life-threatening cardiac arrhythmia. Her heart was not pumping blood effectively. Oxygen supply to her brain was dropping. She was seconds away from cardiac arrest. Emergency medications were administered. Defibrillation pads were placed. The room filled with urgency. Within minutes, her rhythm stabilized. But the question remained: why did a healthy 28-year-old woman almost die from a heart problem? Further tests revealed the truth. She had an undiagnosed genetic heart condition, one that often remains silent until triggered by stress, dehydration, or fatigue. Her early symptoms were subtle: dizziness, fatigue, mild chest tightness, symptoms that are often ignored by patients and underestimated by doctors. If her collapse had happened at home, she would not have survived. Later, cardiologists reviewed her first ER visit. Everything made sense in hindsight. The dizziness wasn't simple dehydration. It was reduced blood flow to the brain. The fatigue wasn't stress. It was poor cardiac output. The chest tightness wasn't anxiety. It was her heart struggling. This case is now discussed in emergency medicine training, not because someone made a mistake, but because the human body whispers before it screams. Medical professionals learn that young age does not mean low risk. Mild symptoms do not mean harmless. And reassurance without investigation can sometimes be deadly. She survived, but many others don't. Across hospitals worldwide, patients collapse every day after being sent home with nothing serious. Sometimes the symptoms are too small, sometimes the warning signs don't fit textbook descriptions, and sometimes the most dangerous conditions hide behind normal vital signs. The lesson is simple, but powerful. Never ignore recurring dizziness. Never dismiss chest tightness, even if it is mild. Never assume anxiety without ruling out life-threatening causes. In medicine, timing is everything. One missed symptom, one delayed test, one assumption. That is all it takes. Because sometimes the smallest symptom is not the beginning of illness. It is the final warning.